So today's topic is very interesting. We are going to talk about Ayurveda and young Indians. और ये टॉपिक इसलिए भी ज़्यादा रिलेवेंट हो जाता है क्योंकि आज का भारतीय युवा, इंडियन यूथ, इज लुकिंग फॉर होलिस्टिक अप्रोच टू द हेल्थ एंड पॉसिबली नॉन इन्वेसिव टेक्निक्स. And because of that, Ayurveda is getting more and more popularity. But at the same time, there are some misconceptions कि अरे आयुर्वेदा ट्रीटमेंट बोले तो बहुत लंबा टाइम लेगा, या इसमें क्या ठीक होता है नहीं होता है, ये सही में इतना 1000 साल पुराना चीज़ है, 1000 है उससे भी ज़्यादा पुराना है, तो आज भी ये काम करता है नहीं करता है. So to answer all these questions, we have a very special guest today. इनका नाम है शारिका मेनन जी. Thank you शारिका जी for joining us. She is dynamic. She is multifaceted. She is heading Shri Wellbeing का research wing. So that was one of my question actually कि इसमें रिसर्च भी हो रहा है कि नहीं हो रहा है, कि चरक संहिता या जो कुछ भी हजारों साल पहले लिखा है वही चल रहा है, या उसमें भी कुछ नयापन आ रहा है. So let's begin this podcast with Sharika ji, and once again thank you Sharika ji for joining me today.
Thank you.
So first of all, for my audience I would like to ask you कि पहले तो आप ये बता दीजिए कि आयुर्वेदा से क्या क्या क्योर हो सकता है.
See, Ayurveda gives a holistic approach. It's not just taking care of a physical ailment or illness, why it is happening, where it is happening. Usually when we see a disease or an illness, it manifests either in the body or mind. So Ayurveda considers a body-mind as a unit, holistic unit, and then treat accordingly. Sometimes it manifests in the mind first and then it will show in the body, and the other way around also. So sometimes many of the reasons, many of the causes of illness is also like that. So when we see Ayurveda can treat anything.
Okay. Nice.
So when we see in the progress of the disease, how the pathology, disease progresses from the symptoms, premonitory symptoms, right, till it manifests, or maybe it may become a complication or something. Of course, there are certain conditions we can only manage, we can support them, but most of the conditions, even in acute conditions, we can help. So that is one of the things. Recently, it was eye-opening when the COVID wave happened.
Yeah.
So there were several situations where we could apply Ayurvedic medications, especially like when the oxygenation level were going down. There were medicines which could act in seconds.
Okay, that's interesting. That's Ayurveda can give the results in instantaneously also.
Yeah.
Okay, you spoke many things. I think I have many questions, follow-up questions on this. So first of all, like when you say Ayurveda can like help with the COVID also, so does it help with the modern day diseases? Like we see rise in psychosomatic diseases, depression बढ़ गया है, लोगों का anxiety बढ़ गया है. There are like so many mental problems. So does Ayurveda come and help there also?
Yes, of course. Mind is by itself treating all that affections on the mind because of the external factors or other behavioral reasons or emotional reasons, stress, all that aspects. Definitely Ayurveda has solution for it, not just by medicines. There are things that we prescribe with correcting the sleep cycle, your lifestyle routine, eating habits.
Okay.
So many things.
So that's a bigger problem then. Like sleep, like on one side there is social media which keeps people awake. On other side there is so much of work pressure.
Yeah.
There are deadlines to meet and वो सब खत्म करना है. So like getting sleep cycle right is a bit challenging, just to say.
Yeah.
Or like we cannot avoid outside food.
Yeah.
काम के लिए बाहर जाना है, ऑफिस में है या फिर ट्रैवल कर रहे हैं, so like will Ayurveda still work with this situation, with the current lifestyle?
Yes, that's what I'm saying. There are certain things, of course, we need to be aware of and correct it on your own. It's not that you can do whatever you want to do, keep continuing and expect nothing to go wrong.
Okay.
That's a different case. But then there are people I've seen who is they have a very disciplined lifestyle, eating habits, good exercise routine, sleep routine. Even then, if they go off the track, maybe with routine or travel or food habits, they still sustain very well.
Okay.
Because this is their backup, support.
Yeah.
Right? So few days if it goes off, it's fine. But then you cannot expect everything go right with one day.
So basically आप बोल रहे हैं कि ये रीजन नहीं कि नहीं मुझे बहुत काम है तो मैं ऐसा ही लाइफस्टाइल फॉलो करूंगा एंड आई विल एक्सपेक्ट कि मेरा हेल्थ अच्छा रहे.
Of course,
Okay,
of course,
okay.
because it will affect so many things. The current situation when we see so many people who come for consultations, at one point they all regret whatever
Okay,
we did.
I agree. Yeah, I have seen that.
And then certain point it becomes so chronic. Sometimes the body and mind become so closed and rigid. Even if we try to start changing the lifestyle or eating habits, introduce medicines, people are close to that, and body will not it will resist.
Yeah.
And then once they relax, once the mind is calm, all the stress they start releasing, then they respond to it.
Okay, so one thing I'm getting is like from whatever you have said so far is कि Ayurveda एक holistic approach है. It's not just you take this pill and you will be cured. So what is your sleep patterns or what are your eating habits or how frequently you exercise or not? So all that is taken into consideration.
Yeah.
Okay, so with all that, again, I'll come back to one of the questions that you already answered, that in COVID you could help people instantly. But there is generally a conception कि आयुर्वेदा एक बहुत लंबा टाइम लेता है. आयुर्वेदा का वो दवाई है, मुझे 2-3 महीना, 4 महीना, 6 महीना लेते रहना पड़ेगा, देन इट विल स्टार्ट शोइंग द रिजल्ट. एंड आज का जमाना इज मुझे आईफोन भी 10 मिनट में चाहिए, इंस्टेंट डिलीवरी होना चाहिए. So, like, is there something instant available in Ayurveda actually?
So, it depends on what condition you have. Okay, so if it is an acute condition, definitely Ayurveda can help. Of course, you're had an emergency accident or some fractures, even then we can help, but then bone setting and all that stuff needs some other support. But it depends on what condition you have. If it's like a years long chronic issue, and then you expect it to change in one dose of medicine, that definitely will not happen. But then if you have a right set of medicines, right dosage, a right treatment plan, you will definitely start seeing changes within 10 days, 15 days. So that's the thing. If you're not seeing changes in 2 months, 3 months also, then there is something wrong with the plan, or maybe you have to report back.
That brings me to next question कि how to identify a good Ayurvedic doctor, like authentic, क्योंकि कुछ लोग वो जड़ी बूटी लेके घूमते हैं या फिर ऐसा सालों से हम जड़ी बूटी देते आ रहे हैं, तो उनके ऊपर भरोसा रखना कभी कभी मुश्किल हो जाता है. सम पीपल कीप गोइंग टू देम, लेकिन कैसे पता चलेगा कि हाँ ये अच्छा आयुर्वेदिक डॉक्टर है, ऑथेंटिक है?
See, I mean, I cannot say like that. There are traditional practitioners and Vaidyas who have this knowledge from generations. There are people hidden in some nooks and corners of India like that also. So we cannot say they don't know anything at all. But then there are some people who does that, unfortunately. But then nowadays, if you see in India, there is a lot of popular good schools and colleges which teach authentic practices of Ayurveda and the science, the Shastra properly. And a lot of doctors are coming up. So that is there. It is not difficult to find. You have to just do your research to find who is good nearby.
And how did you like got into Ayurveda? Like what pulled you into mainly Shri schools?
I came by chance.
Okay.
I didn't have any plan to learn Ayurveda. It's just because of Gurudev's grace and his intention to start this college.
Okay.
So everything fell in place, and I happened to be in first batch when it started.
Oh wow.
So I'm very grateful that time I didn't have any clue about Ayurveda. Though I'm from Kerala. Kerala is it's a hub of traditional practices in Ayurveda, and so many brilliant Vaidyas and schools. I didn't have any clue about it, because even though we have some small practices at home, daily practices, my grandparents and all that, there was no focus like that. So when Gurudev started the school, my father, obviously, he wanted me to be in the ashram environment. So he put me here, and then I fell in love with this science.
Oh wow.
I am very grateful that I studied this. And even now I cannot say that I have finished learning it. It's never ending. It's
yeah.
every time I read the same thing which I would have read in the first year, it's something new. So I'm very
Yeah,
grateful for
one
that.
thing I have noticed is those who are very sharp, very intelligent, they always say, "I'm still learning," and don't claim that, okay, I know it all.
I
Yeah,
don't
yeah.
know. I cannot say if it's like what we know is maybe 1 or 2%. What we
No,
don't know
but
is
with that 1 or 2%, you are bringing such a big change.
yeah.
I know you have worked in many countries, bringing this knowledge of Ayurveda and wellness, holistic wellness, to different people. So, like, do you remember any memorable incidents where like patients felt, wow, okay, ये इतना आसान था और हम क्या क्या कर रहे थे इसके लिए?
No, that there is so many things. Like some people come with pain. With one session of certain treatments, certain there are not just it's Ayurveda is not just about herbal medications intake and massages.
Oh,
There are
okay.
certain techniques, parasurgical techniques and all that for pain management.
Oh, parasurgical techniques are
Yeah,
available?
yeah. So
Okay.
it's like Agni Karma, Siraveda, bloodletting. So many things like minor procedures. So it gives instant
Truly
relief.
speaking, like I am going to Ayurvedic doctors. I have come to you also for like long time now, but I didn't know about this, that it's available.
Yeah, so
Okay.
it depends on the situation, of course, what we prescribe. So there are like one lady came with severe pain on the back, there's very cramped muscle, there is swelling, and we did. There is a bloodletting procedure called Prachanna. So we did one session and she's free from
Oh,
that
wow.
pain. So there is another one of our colleague. He's suffering from tennis elbow from years together, 10, 15 years. And then just 2 sittings and
Okay.
he's free from pain from past 4, 5 years.
Wow.
So there are techniques like that. And one thing I want to share is during COVID, because that was a serious situation those
Yeah.
days, and we also didn't know because we were treating casually, I mean not casually in the sense regular treatments, line
Yeah.
of treatments, general conditions,
Yeah. Yeah.
people come to us when there is digestive problems or one bone joint problem, back pain, headaches, something like that.
Yeah.
They never thought we can address emergency situations.
Okay.
People doesn't have that awareness.
Yeah.
So even managing fevers, people will never come to Ayurveda.
Yeah,
They
yeah.
would rather take paracetamol or
Yes. Now Dolo.
Dolo
After
or whatever.
COVID, yeah.
Yeah. So those days there was one family where their father, he refused to go to the hospital and his oxygen levels were dipping. He said, "You don't even dare to bring the oxygen cylinder inside my room.
Okay.
Okay, so whatever you can treat me here, I'll do that. I'm not going to step out of the house."
Okay.
So they were all in panic. She was my friend, colleague. She's also a pathologist, allopathic doctor.
Okay.
And then we happened to connect, and then I gave few remedies. And every time they give the dose, and the oxygen levels that was like below 80 would go up to 95, 97.
Okay.
In room temperature. But he refused to
Oh,
keep
that's
it.
interesting.
Yeah.
There was such a huge crisis about like oxygen
Yes.
cylinders not
Yeah.
available. In fact, even I didn't know about it because I'm like I was in Mumbai that time and I was trying to find hospital for patients. Like we opened a helpline there.
Yeah.
Some of volunteers got together from
Yeah.
Art of Living.
Yeah.
Oh, that's interesting.
So,
So I
like-
think we'll need many such sessions
so
like this. I don't think we'll be able to cover a whole depth of Ayurveda itself.
Yeah, it's
So
really vast.
let me ask you another question because that's what fascinated me about Ayurveda. Like long back when I went to one of the doctors, Ayurveda doctors, she just kept hand over here for maybe 10-15 seconds and she asked me कि बचपन में तुमको जॉन्डिस हुआ था क्या? And I was like, 10 सेकंड में कैसे पता चल रहा है तुमको? वर्सेस दैट इफ वी गो टू एलोपैथिक डॉक्टर, वो पहले सिम्टम पूछते हैं, अभी तुम्हारा क्या कंडीशन है, क्या हो रहा है, फिर बताते हैं. और इन्होंने हाथ, और मैं उसके बाद में तो मैं जब भी जाता हूँ लाइक डॉक्टर, आयुर्वेदा डॉक्टर, दे स्टार्ट टेलिंग कि हाँ तुमको ये हो रहा है, सही है नहीं है. सो हाउ डज दैट हैपन? लाइक इट्स मैजिकल फॉर अ पर्सन लाइक हु हैजंट like seen this before.
Yeah, so that is Nadi Pariksha. That is what it does. So Nadi Pariksha is a Shastra, science by itself. So it's one of the techniques we
It's not intuitive, it's a science.
It is also intuition. See, Ayurveda, you cannot go with only logic.
Okay.
Logic is there.
Uh-huh.
But then after a certain point of practice, it is more of that siddhi, that intuition.
Okay.
And it is always right. So, and the medicines also work like that. Sometimes some random medicine will come in your mind, and then when you actually read about it, it is the right one for.
Okay.
So, Nadi Pariksha is also like that. There is a science which our masters have taught. There are some do's and don'ts and all the practices that we need to do to
Okay.
learn it.
Okay.
Once you learn it, and then it is your practice, how much time you give it to it, and that practice will give you back.
Yeah. Okay.
So that is how all the Nadi doctors, even then, at one point it was not very popular. And then Gurudev's vision was also to revive this. There were so many doctors as they have learnt Nadi Pariksha here. And then they have seen, we can see, when we teach also sometimes, and those young doctors, when they check the first time and then they find something, they are like, their eyes will be like,
Yeah.
bright and surprised. How can I get this?
Okay.
So, of course.
No, so like that's very interesting. But for the audience, like because it will be on YouTube, the people all over India and maybe abroad, they also watch this. So if somebody wants to get Nadi Pariksha done, like we can obviously come to Bangalore Art of Living Center and it can be done. But like if they are in say Mumbai, Nagpur, Delhi, what's the way out? Like is it possible for them to?
Yes. So we have doctors all across India, all across globe. People are traveling.
But how to connect to them?
So we have Shishi Tattwa's coordinators, Nadi team. They work region based, and then they have all the contacts, which doctor in which locality and all that. So we can look for in the Shishi Tattwa's website.
Okay.
You'll get all the information there, or even if any camp updates are there, everything will be there. Okay. So locally also we have people conducting camps, and then they invite a doctor and keep in touch with the.
Okay, so as you said, like you are looking to take this knowledge and this practice to masses, and that's where you are organizing camps.
And so yes, of course. So this knowledge has to reach everywhere.
Yeah,
so
obviously.
You sit one place, it is not enough. So there are so many people has to join hands and. Yeah. So we have Panchakarma centers also in different locations.
Okay.
Our main center is obviously in the Bangalore ashram, and most of the doctors do both online as well as offline consultations.
Okay, online consultation is also available
there. So if you want to follow up with them, you're traveling, you're elsewhere. It is always good to get in touch with the doctor. So because they have been seeing you for many times, they know what is going on in you, what changed, what needs to be done, or if it's balance or something went wrong. It's also important to check if you're going all right in the right track. So it's not just about treating imbalances, no. Only when you have a problem, you don't have to go. When you don't have a problem, that is when you have to see the doctor, so that you maintain it.
Okay. So from one of my Art of Living teachers, I heard that he goes for Nadi Pariksha, as you said. Even if nothing is there, like every 2 months, 3 months, he will get Nadi Pariksha done. He says कि कुछ आने वाला रहेगा तो वो पहले ही पता चल जाएगा, तो क्यों हम पहले दर्द को होने दे और फिर. So how does that work? Like how do you know कि हाँ 2-3 महीने बाद ये बीमारी आ सकती है?
So when we do the Nadi, we get the indication. No? So what tendencies you have. Based on that, we will understand which is the weak spot that is developing or what can go wrong if you ignore.
Okay.
So that you can identify easily.
Okay. No, but how do you identify that? Like this is the weak spot. This is what might happen after maybe few months.
That is through Nadi, of course.
Okay, so we'll have to learn it, like if you want to know.
And then Ayurveda, there is a clear understanding how a pathology develops, how it progresses.
Okay.
Right from premonitory symptoms until how it becomes a complication. So every stage you can identify.
Okay.
So that is something which has it gone to affect the organs, or is it before that, or is it also affected all the dhatus, or it's just limited to your gut.
Okay.
So like that you can understand if it's localized or it's spread.
Wow. It's such a nice. I think it's like people should get benefited. Those whoever are watching, please go and get your Nadi Pariksha done and get amazed.
Yeah, of course.
Yeah. So let me get back to another question, which is what generally happens. And nowadays there are so many remedies that floats around. WhatsApp पे आ जाता है, YouTube पे कोई वीडियो डाल देता है, ये तुमको गैस हो गया तुम ये करो. So like how does one identify कि हाँ ये मेरे लिए करना सही है नहीं है, या फिर will it have the repercussion also कि भाई ये रेमेडी किया, अरे इसके वजह से पैर तो ठीक हुआ लेकिन सर दुखने लग गया अभी.
Absolutely. Yeah, so that happens. I've seen a lot of people coming up, because it's helped somebody else, it should help me also. This they are saying that it is working for this, why didn't it work for me? So it's absolutely unique and different for everyone.
Okay.
So sometimes, for example, cucumber can be cooling for somebody, can give acidity and bloating gas for someone else.
Oh, okay.
So it depends on what imbalances that you are going through, or your body may not accept everything. Everybody has their own, body will accept certain things. Body is able to process certain things.
Yeah.
Even if something goes wrong, also they are able to process. Somebody else, it is not like that.
Yeah, yeah.
Small change, everything will flare up. So it is always different for everyone. It's always better to talk to the doctor and understand what suits me, what doesn't suit me.
Okay.
Then and then accordingly you have to plan around that. So certain things, for example, milk. Some people, when they drink milk, a small amount of milk, no problem. But when they have had 2 glasses of milk in a day, it gives them bloating or loose motions, some discomfort like that.
Yeah.
But then they'll ask, oh, why I have to drink milk, So you may have to drink it in a different way, or maybe not that much portion. You may have to limit it to certain amount.
Or add something like my mom adds haldi and ghee.
Something like that. Okay. So you have to balance it. It's definitely not agreeing with you. Just because of that, you cannot force it into your system.
Yeah.
And body will reject it or give you an imbalance. So for every food item, it is like that.
Okay.
So you have to identify how much is okay for me,
Yeah.
and what all things are okay for me. If there are certain things which doesn't agree with me, maybe small portion is okay, not more than that. Once a week is okay, but not more than that. So like that, you have to be a little aware.
Okay.
Initially, you can get guidance from the doctor, Vaidya. After checking the Nadi, they will get more clarity. And then you stick to that.
Okay. Okay, and so one again important question. So like many people are looking for alternative therapies other than allopathy, mainly because like most of the allopathic medicines have side effect. कि भाई किडनी का प्रॉब्लम है उसको ठीक करेगा लेकिन उसके बाद फिर दूसरा कुछ प्रॉब्लम आ जाता है. तो आयुर्वेदा के साथ भी ये प्रॉब्लम है कि जब आप लाइक व्हेन यू प्रिस्क्राइब सम मेडिसिंस कि आप ये ले लो, सो वहाँ पे भी साइड इफेक्ट होता है. सो बिकॉज लाइक एज यू आर सेइंग कि हाँ कुकुम्बर का एग्जांपल लिया, तो कूलिंग तो है लेकिन गैसेस हो रहा है.
So that's it. Of any herb you take, it has certain properties, effect on the body, mind, and all that. So the way it helps you or not, you have to choose the right drug. And certain people come to me after taking Ayurveda medicine. I got acidity. That's a common. Everybody thinks Ayurveda medicines give acidity.
Okay.
So that is a very wrong understanding. Probably that medicine didn't suit you, or the dosage didn't suit you. Okay. So you cannot cut and right claim like that. You have to go back to your doctor and tell this much dosage gave me this problem. So they will modify and give it to you. So that is one thing. And then another thing I have heard is people have this fear that taking Ayurveda, it gives toxins in the liver and kidney and whatnot.
Yeah, recently I also came across that कुछ arsenic रहता है medicine में and that will impact your liver, etc.
So
is that true?
It is not like that. See, there are mineral and metal ingredients which we use in preparation, but then that is prepared in such a way it is assimilated easily, and the if you say it is very minute micro particles, nanoparticles. Okay. It will easily filter through kidney, liver, everything. It will not cause toxicity. So it is also tested and proven like that. You
Okay.
know, all the formulations go through rigorous testing. If the herbs, they go through all the sorting and everything, if it is good or not, if there is contamination or not, all that, then it will go to the manufacturing, and then we test it, you know, all the toxicity, everything, and then it goes into the, you know, consumption.
Okay.
So without that, none of the medicines go into the market. So people should be aware of good brands, you know, which make it properly,
Yeah.
follow all the steps, necessary steps, and then you take it. You cannot take anything whatever you find on the market. Maybe that may cause, you know, problems.
Okay.
So just because of few you know, some mishaps like that, you cannot blame the whole Ayurveda community like
Got
that.
it. Like I think it's the same everywhere.
Yeah.
So another follow-up question on that, like on one side, like people are now becoming aware, they are looking towards Ayurveda, and there are people who are following like Ayurvedic practices. And now I have seen some people कि भाई डॉक्टर के पास नहीं जाते, आज मैं एस्टी मधु ले लूँगा, आज मैं कामधुदा रस ले लूँगा, like वो खुद से ही ले लेते हैं, मुझे ये हुआ है, मैं so is that okay to do that, or like
See,
what do you suggest?
there are two things here. Of course, over the counter I would not recommend. You know, sometimes you may not understand what suits you that moment or that, you know, treatment,
or the long term effect of that.
So like for example, see, fever, earlier this medicine worked. So this time let me try the same thing. So it may be a different manifestation of, you know, the fever, the signs, symptoms, where it is affected, all that could be totally different. Just because of temperature is there, you may not, you know, go for the same set of medicine. It may not work.
Okay.
So that is one thing. And over the counter, long term intake of certain herbs, I've seen people taking like that, turmeric or yashti madhu long time, and maybe so many things like that. They've heard this is a good thing. So that is not a good idea to do that. We don't know, on long term certain herbs has problems. You cannot take it long term. One is they'll give some effects, it will have some implications in the body. And second thing is, any medicine, because of its potency, the way it acts, if you're taking long term, it will start acting like food.
Okay.
You know, so it will not give you the benefit of medicine. So it's always better to go back to your doctor and, okay, what herbs can be taken long term, what cannot, all that understanding only the doctor will know. You know, what suits you. And then there are certain cases, like for example for kids, you know, they keep getting some digestive problems, fever. So I have trained them parents, what are the emergency medicines that to be given. Okay, if they have a sore throat and cold, what to give. If they're showing some signs of digestive issues, what to give. Slight fever, what to give. If you're not able to manage in 1 day, 2 day, you get back to me.
Okay.
So after 1 year of you know, constant touch, and then they also understand how to treat it. So because sometimes we cannot immediately reach out, you know, to the doctor. So I have a lot of families and parents who are able to do that successfully. Only if it goes beyond their control, within 1 day, 2 day, it doesn't respond, then they'll come back. So that is also there. So I'm not saying, you know, for emergency, you can definitely use it.
Okay. But not हाँ कुछ भी चलो आज ये ले लेते हैं थोड़ा बहुत. Okay. Again, a follow-up questions on the side effect thing. So one of my family members had some kidney problem, kidneys little shrunk, तो उसका कुछ दवाई चालू है. So डॉक्टर ने बोला कि भाई ये दवाई लेंगे तो इसके वजह से पोस्चरल बीपी का प्रॉब्लम रहेगा. When he stands or sits तो बीपी goes down suddenly. तो उसके लिए दूसरा दवाई दिया, और फिर उस दवाई से जो इम्पैक्ट होता है उसके लिए और दूसरा दवाई. So like there is a series of medicines now he's taking. So like आयुर्वेदा का भी ऐसा ही है कि लाइक इट ब्रिंग्स अ लाइक बिग डिफरेंस कि एक दवाई दिया उसका साइड इफेक्ट है, सो यू विल हैव टू टेक अनदर मेडिसिन देन अनदर मेडिसिन, और लाइक व्हाट यू आर टॉकिंग अबाउट लाइक स्मॉल लिटिल थिंग. हाँ एसिडिटी बढ़ गया ठीक है, जब कोई बड़ा डिसीज हुआ है उसमें यानी वन विल नॉट माइंड कि हाँ थोड़ा हल्का सा बुखार आ गया या ये हो गया, बट लाइक आर देयर लाइक मेजर इम्पैक्ट्स कि हाँ तुम्हारा इफ यू टेक दिस मेडिसिन टू क्योर लाइक वन थिंग समथिंग एल्स विल फेल.
No, I mean it's not like that. So in Ayurveda, For example, certain, let's say inflammation. So the sore throat, it's also from like inflammation. If you don't treat it on time, it can go into and affect the lungs, and it become a full-fledged cough, cold, congestion in the chest. So the inflammation can spread into the lungs. So Ayurveda can predict where it is heading to and then prevent it. So we give it immediately. And then there are certain conditions, of course, if it's gone too bad, instead of mixing everything together, allopathic and Ayurveda, it is better to follow one set. Maybe Ayurveda can help like a supportive treatment, managing the complications or any other side effects and all that. That definitely is possible. But then we don't, if unless and until we understand how the drugs interact, allopathy, we don't know what, so many things are going on, they keep changing or something. Similar in Ayurveda also, we introduce some, incompatible, it doesn't go well together. We call it as drug interactions. So that have to be, doctors have to be careful with that. So Ayurvedic doctors should know some background what the treatment is going on, and based on that they have to support. If the patient is not willing to go off that, so that happens. So any situation Ayurveda can blend in and support. It's not like always, okay, you just go off this and switch to this. It's not like that.
Fine. I have a few more questions. I think we haven't spoken about Panchakarma, but like looking at time, maybe we would like to have part 2 of these sessions whenever you are available. But like if you can just briefly talk about Panchakarma, like how is Ayurveda and Panchakarma related, and Panchakarma treatments are must or not? Like how does that work?
So Panchakarma is part of Ayurvedic treatments. It's one line of treatment. Panchakarma means 5 procedures. Pancha is 5, karma is procedures. So it's a deep cleansing, bio-cleansing, detox kind of a procedure. And depending on the condition or what dosha is affected, at what level it is affected, what system is affected, we plan the line of treatment. So there is a sequence. It's not like walk in and I need a Panchakarma, you cannot give it. So many people come like that, I need a Panchakarma. So we can clearly understand that they don't know what Panchakarma is. So Panchakarma needs proper preparation. Prior preparation, we have to understand how their digestive system, metabolism works, what level the imbalances or doshas are accumulated, toxin accumulation. All this we have to understand and then plan step by step. So there will be correction of the Agni, then there will be certain medicines or certain preparations that will go on. And then the doctor will understand, okay, now you are ready for Panchakarma. So that is when you need to plan and come. And then they'll plan it. So there are certain procedures where we induce vomiting or induce purgation, enemas. These are all vague translations. So similar like that. So once that is done also, and this also has to be done with the doctor's supervision, guidance, diet, rest. It's not like you are working
you get the
all day
treatment, then work and
it's not like that. You have to give your time for that. Then only healing happens. You have to cut down from
outside world.
All the stressful activities. Mind has to be. And a lot of people have shared that while Panchakarma, their emotions, whatever suppressed stress and
Panchakarma works on that also.
I have seen so many people, they burst out crying at one point and then there's something released. So it is not about just cleaning the gut. It's all the deep-seated toxins. It clears up. So, and then after that, if there is any chronic issues, you can see the huge progress after that, how it changes, progresses, that healing that happens. So Panchakarma, you can do it periodically. If you have a problem, according to the problem, doctor will guide you. Or if you want to just maintain, okay, I know what tendencies I have this problems, I keep getting this. So to maintain your health, at least once a year, if you keep doing it, it will keep it under control.
Okay. Sorry, one last question. So, does all the Ayurvedic doctors do Nadi Pariksha? Like they put hand here, or because like I have seen one doctor who asked symptom, and I was like, ये सही में आयुर्वेदा डॉक्टर है कि नहीं है?
No, it's not like that. There are doctors who have their own way of diagnosing.
Okay.
So that is also possible in many parts of India.
Okay.
So in Shishi Tattva Shishi Wellbeing, all the doctors we practice Nadi Pariksha
Okay.
as the diagnostic tool. There are other Vaidyas who focus on other things. You know, some people look in the eyes, tongue. They may take a detailed questions and history and then plan. So that is also there. So not all Ayurveda doctors depend on.
Okay, so the Nadi Pariksha is basically a specialty in the Ayurveda.
Yes.
Okay. Okay. Thank you very much, doctor, for joining and helping the audience. So, any last message for our audience that you would like to give?
So Ayurveda is not like not just what you see on a toothpaste, or just on some products, just whatever herbal is not Ayurveda. Ayurveda is a philosophy. It is a way of living.
Okay.
It teaches you. It's like a manual for right living, especially in this kind of situation and the lifestyle that we have now. The world is going through so much of changes, stress.
Yeah.
So Ayurveda will give that balance, if you understand. So it's not just limited to diseases. It is about keeping your maintaining your wellness.
Okay.
So that's Ayurveda about.
Yeah. Thank you. Thank you very much for joining me today.